Hello, and on page 40, 4F at the doctor's, I can talk about illnesses, their symptoms and treatment. Some common illnesses are the flu, cold, a stomach bug or virus, an ear infection, or maybe even a hay fever. So when was the last time you were ill? What was the matter with you? Did you take any medicine? Did you go to the doctor's? Did you take time off school? Well, let's have a look at exercise number 1. Complete the dialogue with the doctor's questions, then listen and check. Okay, so here we go. Doctor, good morning. What can I do for you? Patient, well, I've got a problem with my eye. Doctor, oh, yes, I can see that. 1E, when did it start? Patient, 3 or 4 days ago. Doctor, I see. 2D, is it painful? Patient, yes, it's very sore. It hurts when I blink. Doctor, let me have a look at it. Yes, the eyelid is very swollen. 3C, have you put any drops in it? Yes, I got some eye drops from the chemist, but they didn't do anything. Doctor, I think you need antibiotics. You've got an eye infection. 4A, are you allergic to penicillin? Patient, no, I'm not. I've taken it before. Doctor, okay, I'm going to prescribe some eye drops as well. Patient, good, thank you. Doctor, 5B, have you had any other symptoms? Patient, no, I haven't. I've been feeling fine. Doctor, good. Now I think you should come back next week. I want to make sure it's getting better, and you must call immediately if it gets worse. Okay, number 2, vocabulary. Complete the sentences with the words below and underline the 2 symptoms that are in the dialogue in exercise 1. Okay, so here we go. Number 1, if a part of your body is swollen, it has got bigger. Number 2, if you're dizzy, you feel as if you might fall over. Number 3, if a part of your body is stiff, you can't move it easily. Number 4, if you've got a temperature, your body is hotter than usual. Number 5, if a part of your body is itchy, you want to scratch it. Number 6, if you've got a blocked up nose, you can't breathe through it. Number 7, if you've got a rash, an area of skin is red. And number 8, if part of your body is sore, that part hurts. We now turn to page 131, exercise 4.4. Symptoms. Okay, we're going to use some medical terms here. So I'm feeling ill, I'm feeling unwell, I'm feeling sick, dizzy, lightheaded, I'm feeling shivery, weak. I've got a headache, I've got an earache, I've got a stomach ache, I've got a cough, a blocked nose, a runny nose, chest pains, a stiff neck, I've got a backache, a rash, a pain in my left side. My thumb is swollen, my thumb is itchy, sore, my thumb is painful, bruised, and numb. Number 2, complete the sentences with symptoms from the chart in exercise 1. Some of the sentences fit more than one symptom. So number 1, I'm feeling so weak, I can't even carry my shopping bags home. Number 2, I've had a stomach ache since I ate those prawns. Number 3, I've got a rash on my arm. Look, it's all red. Number 4, I can't smell anything. I've got a blocked nose. Number 5, my right ankle is very swollen. Look, it's much bigger than the left one. Number 6, my shins are bruised after that football match. Look, they're black and blue. Number 7, I'm feeling dizzy. Hold my arm, I'm going to fall over. Number 8, I can't turn my head to look at you. I've got a stiff neck. Number 9, my back is itchy. Can you scratch it for me? So we're back on page 40. Exercise number 3. Listen to 4 patients. Match the patients with the symptoms. Each person has got 2 different symptoms. Write patient 1, patient 2, patient 3 or 4. All right, so here we go. Doctor, hello, come in. What brings you here today? Patient, I'm not very well. Doctor, I see. What are your symptoms exactly? Patient, I feel hot and shivery. Doctor, let me take your temperature. Yes, you've got a temperature. It's quite high. Have you got a headache? Patient, yes, I have. Doctor, what about a stiff neck? Patient, no, my neck's fine. Doctor, have you noticed a rash anywhere on your skin? Patient, no, I don't think so. Doctor, well, I'm sure it's just a normal virus. You need to drink lots of water. If I were you, I wouldn't worry about food until you're better. Just eat when you're hungry. Patient, okay, so I don't need any medicine? Doctor, no, just rest and, as I say, plenty of water. Patient, thanks, doctor. All right, the second dialogue. Doctor, come in, hello, how can I help you? Patient, well, I had an accident yesterday. I fell out of a tree. Doctor, oh, really, how far did you fall? Patient, probably 2 meters, but I banged my head. Doctor, right, and have you been having any symptoms? Patient, I've had a bad headache all day today and I'm feeling a bit sick too. Doctor, I think you've got concussion. How did you get here? Patient, on my bike. Doctor, I don't think you should cycle home. Can somebody pick you up? Patient, yes, my dad. Is it serious? Doctor, probably not, but if your symptoms get worse, call the hospital. It's very important to be careful about head injuries. Patient, okay, thanks for your help. Doctor, you're welcome. Dialogue 3. Doctor, hello, come in. How can I help? Patient, I've got an upset stomach. Doctor, how long have you had it? Patient, just a couple of days. Doctor, any other symptoms? Headache, fever? Patient, no, just my stomach. I feel sick too. Doctor, can you remember eating anything unusual? Anything that tasted bad? Patient, I had some chicken at my uncle's house at a barbecue. It wasn't really cooked. It was still pink in the middle, but I had to eat it. Doctor, well, that's probably what caused it. It's very important to cook meat properly. Patient, can you give me anything to make me feel better? Doctor, I don't think you need to take anything. Drink plenty of water. Don't worry about eating anything yet. Patient, okay, thanks. Doctor, and you must take extra care washing your hands. Patient, okay, I'll do that. Doctor, anything else I can help you with? Patient, yes, is there a toilet here? Doctor, yes, first door on your right. Patient, thanks, bye. Number 4. The fourth dialogue. Doctor, good morning, how can I help you? Patient, hello doctor, I'm feeling really bad. I've got an upset stomach. Doctor, oh dear, I'm sorry to hear that. Sit down and I'll take a look at you. Patient, it started about a week ago. I had a really bad headache for 2 days. Doctor, did you take anything for it? Patient, yes, just ordinary painkillers. Doctor, let me take your temperature. 38.9. Yes, you've got a temperature. Really? Is it very high? Doctor, don't worry. It's just a virus, I'm sure. Have you had any other symptoms? Patient, no, not really. Doctor, the best thing would be to stay at home for a few days. Patient, but I'm really busy at work. Can't you just give me some antibiotics? Doctor, no, you don't need antibiotics. Try to rest as much as possible. You'll get better soon. Patient, okay, thanks, doctor. So if you look at exercise number 3, patient 1 and patient 2 had the headache. Patient 1 and patient 4 had the temperature. Patient 2 and patient 3 felt sick. And patient 3 and patient 4 had an upset stomach. Okay, when giving advice, we can use these expressions to give advice. I think you should. I don't think you should. If I were you, I would. I wouldn't. Try to. In your position, I would. You need to. It's important to. You must or you mustn't. The best thing would be to. You ought to. You really ought to. It would be a good idea not to. Okay, so exercise number 6. Write the doctor's advice using the suitable expressions from the Learn This box. There may be more than one correct answer. So, number 1, you need to drink lots of water. Number 2, if I were you, I wouldn't worry about food until you're better. Number 3, I don't think you should cycle home. Number 4, you need to be careful about head injuries. Number 5, you need to cook meat properly. Number 6, you must take extra care washing your hands. Number 7, I think you should stay at home for a few days. Number 8, the best thing would be to rest as much as possible. And now in our workbooks we do exercise 1. We do exercise 1 and exercise 4. 1 and 4. And that's all for now. Bye-bye.